My name is Steve Knope. I'm an internist, a board-certified internist. I've been practicing in this town for 16 years, and I run a private practice, and I am an advocate for private medicine. Okay. Despite what you think and what you have done, what we've all done, and despite the polls, which clearly show that the majority of Americans do not favor nationalized medicine, there is still a very good chance, as you know, that this may go through, right? This may go through what's been called the nuclear option or reconciliation, in which they may be able to get 51 votes in the Senate and pass some sort of nationalized health care. The reason to tell you that is, number one, I think it's important that you continue to speak your mind, continue to speak out, number one. Number two, if they get this through, don't buy into the idea for 1 second that this cannot be reversed, because it can, okay? So, this is not scheduled to go into effect until 2013, and anybody who votes for this, I think, is going to pay for it in 2010, so just keep speaking your mind. They push something through, and then there's no question in my mind that there will be a Republican candidate who will run on a platform to simply repeal this, because it's not sustainable. Now, why do I say this? Let's just run through the highlights, because this discussion has become so complicated in so many details. Barack Obama's position was that we cannot afford to do the same thing. It will bankrupt this country if we continue to run things the way we're running it. We need the government. In comes the CBO, the Congressional Budget Office, and says what? This is going to cost more than what we've got now. Now, in any discussion of logic, any discussion in which we're speaking about facts, that should have ended the bill, ended discussion altogether. Back to the drawing board, right? But it didn't. So this thing is ideologically driven, it's not driven by fact. There's not a shred of evidence that nationalized medicine is, number one, going to save anybody any money, and as you've all figured out now, there's going to be a huge chunk of money taken out of the Medicare dollar. $648 billion is going to be taken out of Medicare, and yet somehow you're going to still get the same care, and we're going to be able to insure another 50 million people, right? It's not going to happen. So none of the facts make sense, right? So what you have to do is just keep fighting. Just keep fighting. And don't give up. And don't give up. And when people like this come in and they call you a racist, say, if it's a reasonable discussion and we've got and each person can state their case, and you say, yes, I'm a racist, now we're going to talk about the facts. You're an angry mob, say yes, I'm an angry mob, I watched Glenn Beck, now let's talk about the facts. You cannot insure another 50 million people, deliver the same level of care, not have any rationing, and not bankrupt the country. As you know, Barack Obama's White House has just announced this week that they made a little glitch and figured out what the deficit will be over the next 10 years. It was a rounding error. We somehow went from 7 trillion to 9 trillion, okay? And yet somehow, we can't really handle the sort of cash for clunkers thing either, but by the way, we'll be able to inherit the entire medical system and run it beautifully and much better than those evil doctors. And frankly, I was kind of worried. I was a little bit late coming over here because I had a diabetic patient who walked into my office with a little sore on his foot, and I was thinking, let's see, I could treat that medically, or I could amputate his leg and get rid of it. Things the President of the United States has said about doctors. My God. Number one, you got some kid who comes there and needs a hospital bed, and he walks in there and teleprompter fails on. He needs a breathalyzer. An inhalator. That were one thing, you'd say fine, but then he gives this example. Let me tell you how he doesn't know what he's talking about. We've got some kid who walks in with tonsillitis, and the doctor says to himself, doctors like Jane and I, who are primary care doctors, well, we could give him antibiotics, or I could make a lot more money by taking out his tonsils. Let's take out his tonsils. Well, I mean, it'd be bad enough to sort of impugn the credibility of an entire profession. On the other hand, it's just plain stupid because Jane and I are primary care physicians. We diagnose and treat pharyngitis. If we decide that a patient needs a tonsillectomy, we refer them to a surgeon, but we don't get any more money from doing that. I mean, the whole argument is ridiculous, right? And let me clarify something else. When we talk about you know, cutting off a leg and getting, you know, what do you say, $30,000, $40,000, $50,000? Do you have any idea what a general surgeon gets for cutting off a leg? It's the maximum, what, I think $740 is the maximum amount, including all the follow-up visits. So what I'm saying is, here's a man who has never run a medical business, has never been a physician, has never run a medical business. He's got the smarts because he went to Harvard to kind of revamp the whole system. And what you're seeing is the wheels are coming off here. And nothing makes sense. And you guys have figured it out. And everyone's figured it out. It's not going to work. It's not going to work. So they're in big trouble. So getting back to it, they're either going to ram this thing through, and they may. I mean, they may just, you know, they may crash the plane. They may ram it through, and then it's going to be even more important that you stand your ground because, number one, this country cannot sustain it financially, and number two, more importantly, you cannot have the government rationing your health care because if you do so, you are not going to like the results. So